Hey everybody, welcome to another episode of Health Careers with Dr. Marn. Yours truly. Thank you for joining me. Thanks for your support. Today we have an awesome episode with another wonderful guest who is excited, genuinely excited about what he's doing and how he's helping people. We're going to talk with someone who is in the mental health field. His name is Dr. Kojo Sarfo. He's a nurse practitioner who specializes in mental health or psychiatry, specifically forensic psychiatry. And we're going to learn how he's having not only a profound, a notable impact on people clinically, but also a profound impact in social media. In fact, Dr. Kojo Sarfo has, as of today, which is April 2021, has over 700,000 followers on Instagram, and also I don't know how many followers has on over 700,000 followers on TikTok. I'm not sure how many followers he has on Instagram, but he has a lot of people following him, and that's because his message is resonating with a lot of people, and he's trying to educate a lot of people about mental health through social media. I think that's a fantastic and important thing to do. So I'm very lucky that he came on board. Very wonderful guest, very respectful, very professional, and very insightful person as well. So before we jump into that, please, if you like this episode, you like this podcast, I would love it if you could give me a 5-star rating on whatever podcast app you utilize. You can also leave a wonderful comment if you can, preferably nice ones versus not so nice ones. And check out my website. On my website, there are blog posts for every episode where you can actually read the transcript and also listen to the episodes for each guest. And there's also the links if you ever want to get a hold of those guests as well. So please check that out. Of course, you can also reach me through my website and email me, and if you need to contact me for whatever reasons, or if there's any particular guests that you'd like to hear about. But without further ado, let's jump into this episode. Today I have Dr. Kojo Sarfo. Hi, Kojo. Welcome.
Hi, Richard. How are you doing? Thank you for having me on.
Oh, it's a pleasure. So glad you're here. Finally, I know we had a little snafu initially early on,
right,
but sounds like everything's better there in that department.
Yes, sir.
So I'd like to jump right into it, Kojo. Can you please give me a quick bio of yourself? Something in about 30 seconds or so, just so people kind of know a little bit about you.
For sure. My name is Kojo. I'm a board-certified psychiatric mental health nurse practitioner. I got my degree from Augusta University. So that's a DNP, a Doctorate of Nursing Practice degree with a specialty in psychiatry. Prior to that, I got my bachelor's from Western Governors University, which is an online school in Utah, Salt Lake City. And I did my training, my nursing training at the University of West Alabama. I got my associate's degree in nursing in 2013. And that was what kind of propelled this whole career, and it started my nursing journey.
Awesome. As a nurse practitioner, what do you do clinically? Like, what exactly are you doing in healthcare?
Right.
Yourself?
So it depends on the specialty, whether it's acute care, geriatrics, psychiatry.
Yeah.
But a nurse practitioner, they assess, they diagnose, they treat patients, and within psychiatry, they also provide supportive psychotherapy as well. And you do this either with a master's degree or a doctorate, but you need at least a master's degree. And in some states it varies because in some states like Georgia, which is the state where I trained in, you have to have a collaborating physician. So this is a physician who reviews. Sometimes the requirements are different, but you have to have in say Georgia, the physician have to review at least 10% of your charts. And in Virginia, where I started my career, you have to have 5 years of having a collaborator before you can be independent. And other states like Arizona and Washington State, from the moment you graduate, you can be independent as a nurse practitioner. So you are a clinician in healthcare, similar to your colleagues who are physician assistants or your colleagues who are physicians. But the training is different. And the main difference between the nurse practitioner and the physician route is that you have the residency, which is required for physicians, is not required for nurse practitioners. It's optional, and they do have residency programs, but it's not required. Like where physicians have to match into a certain program. I would say that's one of the biggest differences.
Got it. Since we're talking about steps to get to your degree, what are the usual steps to achieve your professional degree? Like, after high school, what do you usually have to do?
So after high school, the most linear path, what you want to do is you want to go into a 4-year program and get your Bachelor's of Science in Nursing. And then after you do that, you can get experience if you want. I think it's a good thing to get experience if you're going to be a nurse practitioner because, like I said, you don't have the requirements of that residency that physicians have. So you're going to be drawing on your experience as a nurse when you were working with the charge nurse and the residents and the attendings. All of those things, are helpful. But the most linear path, you need a 4-year Bachelor's of Science in Nursing degree, or you can get the associates, then get the bachelor's. But to keep it, straightforward, get a 4-year nursing degree, and then after that, you get a Master's of Science in Nursing for your nurse practitioner, and that's a 2-year degree. If you want to go the extra year for your doctorate, you can. But for a high school student, you could graduate, do a 4-year program in nursing, and then you could do a 2-year, master's level graduate program to receive a nurse practitioner degree. So you can do it in 6 years.
Got it. What is the best part of your career?
The best part of my career is, the versatility. And, for me, within psychiatry, the fact that I got to go through the nursing route and spend so much time with the patients and then working on the unit, as a RN, I got to learn from the charge nurses and I got to learn from the psychiatrists and I got to ask all these questions which prepared me for my schooling, as a nurse practitioner. So once I got into the profession, the best part is that you get to be a clinician, you get to have your own patients assess, diagnose, treat, refer out, provide, supportive psychotherapy. And at the same time, you're in a position to where you can learn. Most states require you to have a collaborating physician, and even in states where it's not a requirement, it's always a good idea to have buddies who have been nurse practitioners for many years, or to have a psychiatrist or a physician in whatever specialty you're in that you can talk to, and the career path, the path I have to take requires you to go through so many hoops, and then you meet so many people. So getting to meet different people in different specialties is very helpful for when you start to practice. So you can ask questions because you're going to have a lot of questions when you start. It's going to be confusing. So the fact that you've gone through the nursing path, you have so many people you can ask questions and get help from.
And what's your least favorite part of your career?
The least favorite part of my career is probably the best. The fact that you can go from being a nurse, carrying out the orders, to being a provider. But at the same time, when you started off as a nurse and then you switch to being a provider, it's difficult to turn that switch on. Because, especially if you've worked as a nurse for so long, because you're used to getting the orders from the physician, and then you become so good at executing it. And then you have to tap into a different part of your brain to be the person who is calling the shots, putting the orders in, making a diagnosis. So it's difficult, or it was difficult for me at first to, flip the switch and go from the RN to the provider. Yeah. And for some people, it's easier or harder, but it was just difficult having to, adjust from going to just carrying out the orders to now I have to be able to explain the medication, the side effects, why we chose this over that.
A different mindset.
Right.
But Kojo, is there a part of your job that is the least part that you like doing, or the least favorable part that you don't look forward to?
Well, within psychiatry as a nurse practitioner,
yeah,
and as somebody who's worked in an inpatient setting, one thing that I don't like is when you have somebody who comes in and they're aggressive either towards themselves or other people, and you have to force medications. And a lot of times you have to do that for their safety or for the safety of other people. You have to go through a process where you have to get a second opinion, and forcing medication on somebody can be quite difficult, to see them, it can be traumatic. So I hate doing it, but working inpatient, I had to do that, a lot.
What do you mean force? You physically give them a shot physically, or just overriding their desires? What do you mean by force?
If somebody is coming in, they're having a psychotic break, and they're trying to harm themselves or other people. If it's a situation where it's emergent and there's a crisis on your hands, you have to go ahead and maybe put them in the chair, administer antipsychotics and things of that nature. And we do that frequently in psychiatry. So that's something that I don't particularly like to do. But to take your question from a different angle, just for nurse practitioners as a whole, if you take out the psychiatry piece, one part that is sometimes frustrating is having to explain the nurse practitioner role. Because believe it or not,
I'm sorry, could you say that again?
One thing that is frustrating about the profession is having to explain the role of a nurse practitioner.
Okay.
And a lot of times, the funny thing is that sometimes you have colleagues who are nurse practitioners, but let's say they're FNP, family NP. Sometimes they don't know the scope of practice of a psychiatric nurse practitioner.
Oh, yeah.
You know, so even within the nurse practitioner profession, different specialties oftentimes don't know how to explain, what each does. So of course you're going to have PAs who don't know the role of nurse practitioners, and PAs, to my knowledge, they can bounce from specialty to specialty. Whereas with the nurse practitioner route, you specialize in a certain thing. And of course, you have physicians who don't know what the role is. So when you go to a new hospital, you may have to let them know this is what you can do. So you would think that they would know, but it's 2021 and we still have to do more education about what each career does. And this podcast is a fantastic way of doing that, to let everybody know what we all kind of do.
Thanks, Kojo. But since we're talking about that,
sure,
there seems to be some misunderstandings. So what is some misconceptions people
have
of maybe not only nurse practitioners, but also psychiatric nurse practitioners?
So a lot of people, for psychiatric nurse practitioners, a lot of people are not aware that psych NPs can provide psychotherapy, whether that's some form of CBT or motivational interviewing. People don't see psych NPs as psychotherapists, and you can actually provide therapy. And also for nurse practitioners as a whole, some people don't realize that they can assess patients and actually diagnose, because people know it to be an advanced practice degree, which it is, but sometimes people will focus in and key in on the nurse part and say, a nurse can't diagnose, a nurse can't assess, a nurse can't prescribe medications, whereas every nurse practitioner can do that. It just depends on the state law. Some states, you can't prescribe like Schedule 2 stimulants and things like that. In some states you can, but every nurse practitioner can assess, diagnose, and treat, and a lot of people don't know that.
I think it's important to highlight that depending on where you live.
Exactly.
The state laws, it can determine your range of practice.
Right, your scope of practice.
Your scope of practice.
For sure.
Got it.
Yeah. A lot of people don't know that. Yeah.
I'm glad we went over that. What is, as a nurse practitioner, what is your typical day like? How would you describe that, start to finish? Like, what time you get in the morning, and when you, what the day is like, how many patients you see, what type of patients you're seeing, what you're doing for them, and then when you leave.
So I was working in forensic psychiatry in Southern Virginia. So a typical day for me, I would come in, I would check the emails, and I would go in and see if I had any admissions overnight. If I had any admissions overnight, I would, normally the social worker, she was on top of things. She was fantastic. So she would send emails, and I would have collateral information on the patient. So I would read about the patient and see what's going on. Is this somebody who needs to be seen right away? Yeah. And if so, if they're like, if they had been in the chair overnight, or if they're having a crisis, you go and you see them, make sure that they're stable. Then you review and get some collateral information. And I would do my best to knock that out first thing in the morning. So that way, when I go into morning report and I get the report from the nurses, I know exactly what's going on, and I'm, not clueless as to what's going on, on the unit. And after we get morning report, then we'll have treatment team meetings. Some days we have the treatment team meetings like around 1 p.m. or so, or some days we'd have after morning report. Yeah. And the treatment team meetings are where you would bring the patients in, and you would do it like after they had been there for 72 hours or 2 weeks or a month. You would bring them in, and you would sort of discuss the game plan. You would review the diagnosis. You would see how the patient has been doing, see if they've been refusing medications. Are they getting better? Are they, feeling like they need more time to be in the hospital? Or sometimes you have to make the executive decision and say, even though this patient wants to go home, we still need them to, be more compliant with medications. We want them to be free of self-harm for at least 7 days or 2 weeks. So we will go over the goals and objectives of what we want to see. And this is where we would call the family members and get their input. And pre-COVID, we'd actually have the family members come in sometimes and talk with the patient. And that was very helpful because these guys and girls were stuck in the inpatient hospital for sometimes months to years. So when they'd have
months to years.
Yeah, within the forensic setting, a lot of them were stuck for a long time. But if somebody came in and they had like a psychotic break and they needed to be placed on the meds, they could leave like much earlier than that. But it was helpful to have family, coming in and giving their input. And family is also great for collateral information. They can let you know how the patient was like at home. So we would do that. And assuming it was a day where we had the treatment team meetings in the morning, after that, then I would go see my other patients on the unit. And I would start off with the patients who had recent medication changes. I would go see them, and I would see the stable patients last. And I would just more so see, hey, are you doing good? Any issues? And then I would go to lunch, and after lunch, I would have to, get some coffee, make sure that I'm not falling asleep, and then I would do charting, and then the charting could take me from like 1 p.m. to 5. But at the same time, working in inpatient stay hospital, you could have, a code, every hospital is different, but sometimes you'll have like a code gray or something like that, or a code white, where you'd have a psychiatric emergency, like a patient fighting or something like that. And then you have to address the situation. If they go in restraints, you have to see them within an hour. So that could throw off the whole flow of the day. So you never know when those things happen, but you have to quickly take care of it and then kind of get back to your day-to-day routine.
Kojo, are you yourself physically restraining these patients when you need to?
You are not. And a lot of times psychiatric nurse practitioners, sometimes it's difficult for us because you've been a nurse. So you've been like helping the techs restrain the patient sometimes. But when you go into the NP role, you become the provider. So you're not physically restraining the patient, but you're giving the orders to the nurses and the techs to say, hey, this patient needs to go in the chair.
Nice.
Maybe they're banging their head or something. So you would, call out the orders and they would follow. But you're not physically restraining them yourself.
I see. Got it. And what is forensic psychiatry? You mentioned that before. What is that?
Right. So it's psychiatry within the forensic setting. And the way I see it, it's very complex because you have patients who have, like a legal history. A lot of them have committed crimes anywhere from petty theft to homicide and arson. And it's psychiatry, but you have to add the forensic component in there. So you have to think about the patient's charges, how safe they are to go back into the community. If they've, if they're a registered sex offender, you have to keep those things in mind when they go out on the pass. So you have to take into account so much more. You have to figure out the legal situation. And sometimes if it's a high-profile case, you might have to go to court. You might be subpoenaed. The judge might want to know what type of care you're providing for a patient. Because I was on a NGRI unit, so that means not guilty by reason of insanity. So my unit was pretty unique to where they would come from a maximum security psychiatric facility to my hospital. And then what I would do, I would assess, the patient, check the diagnosis, make sure I agree with it. If I change it, provide a rationale as to why I changed it, continue medications, or, put them on something else. And then we would work on something which we call the conditional release plan. So these, because they're NGRI, they're not guilty by reason of insanity. So if they didn't have a mental health condition, they would be incarcerated. So we work with the psychologist closely with them and the social workers to make sure that they go through a graduated privileging system. And as they, become more and more stable, and as they demonstrate that they are safe to go back in the community, the conditional release plan will allow that person to go back into the community, but they have to be in somewhat of a controlled environment to make sure that they're, still taking their medications, that they're not going to be harmful towards themselves or anybody else in the community. So it's pretty unique.
So forensic psychiatry relates to people who have had issues with the law?
Right.
Is that all right? And so part of your job is to assess how and when they can be put back into the general population. Is that, am I hearing that right?
For the patients who are in NGRI, not guilty by reason of insanity, and some patients, but depending on the crime or what happened, they may never be in the community as we know it. They may have to go into special housing, especially if they've had a crime that was quite egregious, or if they're a sex offender or something like that.
Got it.
You have to find like specialized homes for them. So it depends on the patient.
You're taking care of some patient. You're basically all the patients you take care of typically have been through jail.
Right.
Got it.
Right.
Can you tell us a story or some of the patients that you've taken care of that where you really had an impact on their care or their life?
Yeah. One patient comes to mind. He had he went to jail for an offense, and he was deemed to be not guilty by reason of insanity. And he had issues to where like he would go through the privileging system, and he would do well, and right before he would get out, something would happen. Maybe he would decompensate or stop taking his medication, so he would have to start back over again. And he had been in the hospital for at least 5 years. He had spent the majority of his 20s in the hospital. And when I transferred his care to a different provider, the last that I heard from him, he was like almost ready to get out. He had a job in the community. He was stable. And I want to say he was somebody, he didn't like, the oral medication. So we transferred him to a long-acting injectable. Some patients prefer that, because, there's a stigma associated with taking pills every day. So if you're able to, put them on a shot like once every 2 weeks or once a month, sometimes that boosts their confidence. And you just have to make sure that they're stable and that they're following through with, therapy, medications. But this guy, he became stable. I want to say that he wasn't hearing as many voices. His mood was much more even. And I want to say he got a job in the community. Like he was working and doing really well. And I would see him sometimes like ride his bike around the city, like even when I was driving home. So it was good to see somebody who, when I first met him, he was very aggressive, amped up. Always, he just had this angry affect to him. And after, work with him for a couple of months, to see him in a better place and that much closer to going back into the community, because it's when you've been in the system for the majority of your 20s, it's tough to transition back to, the life that we live. In
Scary.
A sense. Yeah, it can be very scary.
Changing gears a little bit. I mean, first of all, that's a great story
Yeah.
of how you've helped one person, especially when they've gone through, jail, the legal system, and they've been they have a rap sheet and such. So that's really awesome that you're able to do that. In terms of the outlook for this type of career, what do you think that looks like?
I think the outlook is fantastic. I think we're at a point in time where, and as you can see with COVID, there's a growing mental health crisis, for everybody. COVID has not discriminated, whether you're a healthcare professional or whether you're just an individual. It's been tough to adjust. We've had to go from working in the hospital to working at home. Some people have lost their jobs. Some people have lost, family members. So with this career being one of the careers that I think is better suited for, the telemedicine sort of setting, I think we're going to see a lot of people pursue psychiatry, if not through the psychiatrist route or the PA route, through their nurse practitioner route. I think you have a lot of people, especially nurses, and there are some programs that allow people to get into a nurse practitioner track without having been a nurse before.
Yeah.
And it's a kind of a controversial program. I don't know too much about that because I went through the nursing track.
Yeah.
But I think the outlook is very encouraging for anybody who wants to, do psychiatry from a nursing, background. You're never going to be out of a job, and you can work inpatient, you can work outpatient, you can set up your own practice, you can collaborate with other providers. There's always going to be somebody who needs someone to talk to, somebody who needs medication. So if you're an empathetic person and you want to be, part of the solution, I think the outlook is very promising.
I think that's a great point you brought up, and occupations that come to mind of people that work in mental health with a professional degree, graduate degree, are a nurse practitioner, like you mentioned, a PA, a psychiatrist, which is a physician,
right?
But also psychologists, where they get their Psych D or PhD.
PhD. Yeah.
Those are the main ones, at least that I can recall, but I have a graduate degree that work in mental health.
Right.
Got it. Okay.
That'd be correct. Yeah, those 5.
What are the type of students you think best flourish in a nursing practitioner career, especially in this kind of psychiatric realm?
The people who would best flourish in this environment, I would probably say, are individuals who, they have, concerns about what they want to do, but they know that they want to be in the mental health field.
Yeah.
And a lot of times people who pursue the psychiatric nurse practitioner track have to ask themselves whether they want to be a psychologist or a psychiatrist. And sometimes, because my role is so hard to explain, I sometimes tell people on TikTok, I say, think of it as if a psychiatrist and a psychologist had a baby. you know, and because you kind of get the best of both worlds. Because to pursue a PsyD track, you would have to either go to grad school for at least 3 to 5 years. I want to say, don't quote me on that, but I want to say, and then obviously a psychiatrist, 4 years of med school, 4 years of residency, maybe an extra fellowship after that. Yeah. So the fact that the training is more concise, as a psychiatric nurse practitioner, it is shorter. And provided that you have a good support system around you, that's the thing. You have to have people that you trust, other providers that you admire how they go about, their day-to-day activities. Provided you have that, you can do a nursing degree or a 4-year, like a 4-year nursing degree, and then you can do 2 years. You don't even have to get your doctorate. You can do a 2-year master's degree program.
Like you did.
Right. And you can go ahead and start to see patients, and you can prescribe medications. That's the difference between the PA, the NP, the MD or DO, and then the PsyD, and then the PhD. As a nurse practitioner, you can prescribe medications, which is big for a lot of people.
Yeah. Being able to prescribe medications and help, and administer therapy. Got it.
Right.
Let's change things a little bit.
Okay.
I want to talk a little bit more about you. Were you someone that was always thinking about going to healthcare, even as a kid, as a student in high school and such? Was that on your mind? It's
funny because in high school there were 3 careers that I mentioned that I wanted to be in high school: an engineer, a physician, and a physician assistant. And it's weird when I think about it. I remember, I had a phase where I was going to be a physician, and I had a phase where I said, no. Okay. I'm going to be an engineer, and I wanted to go to Georgia Tech. My grades weren't good, so that plan went out the window pretty fast. And then I heard about the physician assistant route, which intrigued me being in high school, and I met other PAs who loved their job, and they were versatile. So I was like, oh, I want to look into the physician assistant track. But my dad, he's a registered nurse as well. He has his PhD in nursing.
I didn't know that, okay.
Right, and I come from a family of nurses, actually.
Oh, okay. So you've been in the healthcare field for a while, so that was on your mind.
Right. He recommended the nursing thing to me. So as I didn't think I would be good at nursing, but as I started to,
Why not?
Because in high school I had so many failures. My GPA was somewhat poor, so it was like a confidence thing. I had to believe that I could do something good. So once I did nursing, I did it to not fail, and I kept going every semester, and then somehow I graduated, and they gave me most outstanding student award, and then it boosted my confidence. And I thought to myself, okay, I can do this. So as I became more confident within nursing, then I started to look into the different tracks within nursing, how I can pursue my education in nursing.
So getting back to your dad, though, because he suggested it, that's what kind of made you go down the nursing route.
Right.
But you weren't thinking nurse practitioner at that time.
Oh, not at all.
That was an idea you came up with in college?
I came up with it's
the
funny.
Idea pursuing that?
Around maybe my halfway through the nursing program, the associate's degree program, I had my mindset on doing nurse anesthesia.
Oh yeah.
I actually wanted to do
nurse
that.
Nurse anesthetist, yeah.
Right. So I actually wanted to do that. I was around other CRNAs who spoke so highly of the career. And my first nursing job was in the ICU, actually. But it wasn't until my dad suggested me to look into mental health that I kind of shifted gears. And as I start to, enjoy that, then I start to look into the nurse practitioner route. And at one point, so I would say after I had my bachelor's in nursing, then I started to seriously consider the nurse practitioner route. And it was either nurse practitioner in psychiatry or psychiatrist. Those are my 2 options at that point.
So interesting. You were actually in nursing undergrad, but you're also thinking about going to medical school.
Yeah, I was.
Got it. The idea was to get to mental health. And again, you took your dad's advice.
Right.
Sounds like a very positive influence on you.
Right. Yeah, he's been a big influence for me. And without his guidance, I wouldn't be where I am today. I'm very grateful.
That's awesome. And so your decision-making process of going into nursing practitioner, that was because your dad, and you want to go into mental health, but why mental health? What was it about it that was so attractive to you at that time?
So when I was in my undergrad nursing program, I remember being at psychiatric facility. It was in Mississippi because like my nursing school is on the Alabama-Mississippi border. So I remember doing clinicals at a hospital in East Mississippi, and the the psychiatric hospital was unlike anything I'd ever seen. Like I had never seen that type of thing before. And I thought it'd be like the movies, but like patients were like just moving about and living their life. And I had so many questions. Like there were question marks, and I was very curious about the mental health side of things. So my curiosity kind of led me into it, and then I went down the whole rabbit hole of the practitioner route. But I didn't understand it, and I had so many questions. So I wanted to have my questions answered. So that's kind of what led me into that.
It's interesting. Your curiosity
Right.
led you to this particular field of mental health in nurse practitioner.
Right.
I see. So it wasn't anybody that necessarily inspired you. It wasn't because you had some patient that you had met kind of inspired you. It was just these curious questions you had about mental health itself.
The curiosity, but the patients I met along the way once I took a job as a staff RN in the psych hospital, the patients that I was exposed to, they were just like me and you. But they just had their own issues. Maybe a family member passed away. Maybe they hit their head and traumatic brain injury in the psych hospital. So they were so much like me, and that kind of propelled me to want to be a bigger advocate for them.
Got it. And reflecting back, Kojo, would you have done anything differently?
I would not have done anything differently at all. And that's a question I've thought about many times. I wouldn't have changed a single thing. Like I'm so fortunate that I had the right people around me who kind of, nobody told me what to do, but they gave me guidance and said, hey, look into this, look into that, look into this, but you can do whatever. And you can succeed at anything that you choose to put your mind to. So I wouldn't change a single thing. I feel very fortunate that I ended up in a career that is needed heavily, within the hospital, and also like in terms of being a mental health advocate. I feel very fortunate to be in this career.
Well, I think you're doing great with
appreciate
what your role is in mental health right now. I want to talk about that a little bit later, but first,
okay,
let's do some rapid fire questions.
For sure.
A little bit about you, if you don't mind. You ready?
I'm ready.
All right. I noticed you were wearing a Lakers outfit before. So what's your favorite sports teams?
My favorite sport in basketball is the Lakers. In football, it's the Tennessee Titans. That's my favorite football team. My favorite baseball team is the Atlanta Braves. And I guess favorite soccer team would be Chelsea.
Wow. All right. Favorite types of books you like to read?
The God of Small Things. I read that book in
The what?
The God of Small Things.
The God of Small Things.
I read that book in high school. I thought it was just a fascinating book. The Alchemist is a good book. Those two come to mind. But in general, I like to read nonfiction books. I remember, we didn't have video games and things like that growing up. I couldn't afford it. So there was like a little mobile library that would come by.
Oh, yeah?
When we were growing up as kids. And I would go in there and I would read autobiographies about people like, Martin Luther King and Bill Clinton. So that was like a hobby of mine as a kid. And I still like reading nonfiction stories.
That's awesome. Your favorite musical instrument that you play or like to listen to?
Guitar, acoustic guitar.
If you're stuck in an island and could bring only two things with you, what would you bring?
Can it be people or
no
things?
Things.
I would bring my acoustic guitar and I would bring my electric bike.
All right. That's different. Got it.
I'm not sure how I would eat.
I don't know how you're gonna charge it.
Right? Yeah, I would be stuck.
From a scale of 1 to 10, how hot do you like your shower water?
8.5.
All right. Do you remember any advice or comments that had a significant impact on how you lived your life so far?
One comes to mind. Whether you think you're right or whether you think whether you think you can or whether you think you can't, you're right. It's something along the lines of. So I remember that.
Do you remember?
I don't remember who told that to me. I think it was an advisor somewhere along the way. Yeah, but that phrase kind of motivated me to just believe in myself and know that I can do the things that I want to do.
Kojo, what do you most value in friendship?
Great question. respect and loyalty.
And what leaders do you most admire, and why?
Great question. I admire Martin Luther King, Gandhi, and Nelson Mandela. I admire people who
great leaders.
Were able to be dominant without having to exert. They never had to overspeak or do anything aggressive, but their presence was felt just by who they were.
Yeah, impactful people.
Right.
Impactful. 2 more questions. What would you consider to be the top 2 or 3 qualities that have made you successful?
Empathy, desire to learn, and flexibility, being able to adjust on the fly.
Nice. And finally, if you were told you only had 1 week left to live, what would you do?
I would, I would go spend as much time with family members and friends as possible. I would put all my money into making memories and just, spending time with them.
Time is awesome. Time is important.
Very
I would
important.
agree too. All right, that's awesome. That's it. That's it for our questions. Thanks for
that was awesome.
participating.
That was great.
Hey,
Thought-provoking.
Kojo, I know we mentioned briefly about TikTok. I think you're doing some people listening to this does not know it, but you have a great follower on TikTok, because I think you're doing a lot of wonderful stuff in TikTok and helping people understand mental health. So
Thank you.
where can listeners learn more about you and reach you and understand what you're doing? What are you doing, and how can people learn more about it?
So I'm using TikTok as a platform to promote mental health awareness and break down, complex, mental health conditions in a way that's clear and concise for people to understand, anywhere from like 7 to 12 seconds. And different little skits and music, video content ideas that make people more comfortable talking about mental health and being open. On TikTok, you can find me at Dr.Kojo Sarfo. And on Instagram is just at Dr. Kojo Sarfo. And those are the 2 main platforms where I post content. So if I post it there, it can be seen anywhere else. But that's like my 2 main channels.
I see. But you're also on other social media as well, not just that.
Right. I'm on Twitter at Dr. Kojo Sarfo, Facebook, the same link, Dr. Kojo Sarfo, YouTube as well, and also Twitch. I just started Twitch streaming.
All right.
Which is, a gaming platform where you can play different games and also just talk to people. So my goal with Twitch is actually to get to the guys. I feel like there's an issue with male mental health and guys
Really?
not being comfortable to be vulnerable enough. And I figured that by playing games, I have a controller here and I have my whole Twitch setup. So, to be able to play like Rocket League or Madden and just talk about, mental health, I think it's going to provide a safe space for a lot of guys who wouldn't otherwise talk about these things. And looking back to myself in high school, I wasn't the most forthcoming with how I was feeling. So I'm trying to be who I needed when I was younger.
That's awesome. You're kind of bringing mental health closer and making it more tangible in their environment.
That's the plan.
That's awesome, Kojo. You also have a website too, right?
That's correct. It's www.kojosarfo.com.
All right. Awesome. Kojo, thank you so much for coming on board and being part of this episode. I really appreciate it. I think when people hear about what you're doing, they'll be very inspired as well.
I appreciate it.
Thank you so much.
Yeah. Thank you for having me on.
Oh, my pleasure.
Thank you.